You can stay there. Easier than.
Good evening, or good morning. What time is it? Good afternoon. Okay, I am here to debate that the situations where laparoscopic repair is better suited than open. These are my disclosures. So if I can get an audience poll, first question, how many of you have actually performed a laparoscopic inguinal hernia repair? Okay, excellent. How many of you consider yourselves an expert in performing the same repair? Okay, very good. So I'll give you my conclusion, and then we can start from the beginning after that. My conclusion is laparoscopic surgery is a skill. Advanced laparoscopic surgery is for the skilled only. And laparoscopic inguinal hernia repair, if performed by the skilled, is suited for almost any situation, with at least as good, if not better, outcomes than open. So I think the VA trial is the best trial to kind of show, and that's what Dr. Veller alluded to, that expert surgeons do very well with laparoscopic surgery. This is the trial that Dr. Fitzgibbon reviewed, open mesh versus laparoscopic mesh repair, almost all TEP, where about 1,000 patients per arm were randomized. My disclosure is I was actually a resident when this trial was going on at the VA, and like Dr. Veller, I did see my attendings kind of try and figure out how to do this, and I was among the surgeons that was following up on these patients. So really the issue is the data between the results from the experienced surgeon versus the inexperienced surgeon. And the VA trial very nicely showed that if you had done 250 cases or more, you were considered an experienced surgeon, and your recurrence rate was very low, 5.1%. Whereas the inexperienced surgeon that had documented having done at least 25 cases and turned in a video in order to be allowed to be a PI on the study, had a recurrence rate of 12.3%, and that was statistically significant. When it came to recurrent hernias, when experienced surgeons performed it laparoscopically versus open, clearly laparoscopy was superior to open. So the result is that when performed by experienced surgeons, laparoscopy is superior to open. It has similar or lower recurrence rates for either unilateral or recurrent hernias, with shorter recovery time and less complications overall. So really what I'm trying to say is that experience counts. We know that in cardiac surgery, the more experienced the surgeon, the better the outcome. Pancreatic surgery, high volume centers have a better outcome in terms of resectability of the cancer. Prostate surgery, the freedom from recurrence is much improved by surgeons who are experienced in the prostatectomy. Even eye surgery, the higher the volume, the lower the recurrence, the lower the complications. So I think if you're going to do laparoscopic surgery, certainly start by doing the easy cases and get over the humps. Sounds much better with sound. Once you get over the humps, really what you can do is then really widely apply laparoscopic hernia for inguinal hernia repairs. We've shown you with the other talks that the major benefit of laparoscopy is the short recovery time. This is the data from the VA trial, which shows that early recovery time is better. I tell my patients you expect to be on pain medications for about 1 day and back to work in about 3 days. Also, I offer it to athletes, busy executives and professionals who really do not want to take much time off and want to go right back to work. Day laborers who can't afford to miss time off work, I do offer laparoscopic surgery to them. And patients with bilateral hernias who would like to have both fixed. Assuming that they can undergo general anesthesia, I do offer and strongly offer laparoscopic surgery to these patients. Also, we know that there's less chronic pain. In fact, if you try not to use any tacks or staples and either use glue, fibrin glue, or what I do is I use nothing and do a TEP procedure without any fixation. Those patients have very little risk of any pain. You won't have pain from the tacking, and the risk of neuropathic pain is minimal.